Right, so this technically should be live. Now, because me and Connor have never done this before, we're just going to check everything's working. So if you can
Okay.
see us on Facebook, please drop a message or a comment in the section so you can so you can see us, and then we'll do the same for YouTube. Oh, there we are. Right, so I think we're live on both. I think, fingers
Okay.
crossed. Oh, someone said
Let me check on YouTube.
no.
Yeah,
Oh, yes.
it says I can see myself on YouTube.
Oh,
Just
there we
lag.
go. Okay, all good. There we go. Oh, Taylor's there. So all Taylor's let us know it's all good on that. Hiya, Taylor Green. So
He doesn't
hello,
have any videos on his channel.
Hello, everybody. My
Hey.
name is obviously Rhys Barber. I'm one of the audiologists at Audiology Associates, and this lovely gentleman next to me here. I'll let you introduce yourself, Connor.
Yeah, this is Conor from Durham Hearing Specialists. Really happy to see you guys. Welcome to the stream.
Yes. So we've never done anything like this before. You've always seen myself and Taylor or myself and Leah. And you guys have been clamoring for a collaboration with a couple of the other guys on Facebook and YouTube. So we reached out to Connor and said, look, would you fancy coming on? And Connor, very lovely Connor, came on and said, yes, we would love to come along. So we've got lots of questions lined up. I'm going to try not to talk too much because I do have a habit of talking a lot. So I'm going to try and stay a little bit more quiet in this live stream. And lots of comments coming in. Hi, Tammy. So saying hi, Rhys. There's got to be some, because Connor's got to have a shout out on here somewhere. Hello from Shropshire, from Jane Corbett. You can say the next one, Connor. Go on, so I'll read them all out otherwise.
Someone from Michigan says, hey.
There you go. We got
Alison. You look so different. Damn it. Get my glasses off. How about
it's that? The filter. He's normally got a filter on. That's what it is, you see.
I'll just spend the rest of the live stream like this, trying to
try to read it. I just realised we've kind of almost got matching glasses on as well. We almost coordinated there, like Connor, almost. So, should we get into some of the questions? So, I know you guys have already been sending a couple in. So, okay, so Maureen Bradley from Facebook asks, I've had my ears checked many times. There's definitely no impacted wax, but I have terrible tinnitus. Can you help? Connor, go on, you could address this one.
I mean, the first things first, if you've definitely not got impacted wax and you've been examined by a professional, which would be a GP, nurse, audiologist, and so on and so forth, then you almost certainly have some underlying hearing loss. So what's the statistic? Over 80% of people with tinnitus have some underlying hearing loss. And it can definitely be helped. So in fact, weirdly enough, if somebody comes into my clinic with tinnitus, which is really bothering them, and they do have an underlying hearing loss, I'm secretly happy about that because it's easier to treat. Much easier to treat than someone who has no hearing loss. In other words, you give the patient a couple of properly fitted hearing aids, and the tinnitus will usually improve quite quickly. So I would suggest you go and see your audiologist for starters. You'll be fine.
Yeah, I mean, just to touch on what you said there, Connor, you said like properly fitted hearing aids. So I think there's this. I think what you'll find is not all clinics are created equally. So what we have is some people will fit hearing aids a certain way, some people will fit hearing aids another way. So what do you mean by a properly fitted hearing aids? I mean, what would you say what's the theory behind that? What's your thoughts on that one?
So, I mean, broadly speaking, if you want tinnitus, if the tinnitus is indeed associated with an underlying hearing loss, which the statistics would say and odds would say probably is the case, then you need hearing aids fitted in such a way that it's giving you the proper amount of amplification at each frequency. And that may seem, you might think, well, surely that's, if I stick a hearing aid in my ear and plug in the test results, that would be sufficient. Actually, no, that's not the case. If every audio system in the world just worked perfectly when you turn on the button and just tell it what to do, then you wouldn't have sound engineers at Wembley Stadium doing sound tests and putting pink noise and white noise through the speaker system and so on. Or you wouldn't have sound engineers in studios tweaking their acoustic treatment to get rid of nodes and frequencies that bounce around in the room and so on and so forth. So the ear is no different. If you want the tinnitus to resolve quickly and you want to follow that expected path that the audiologist is telling you, the hearing aids need to be ideally measured in when it's inside of your ear in some fashion, to make sure that it's actually providing the correct amount of amplification, because otherwise, if you're under amplified, it might help, but the tinnitus is more likely to hang around. Does that make sense?
And statistically, when
that
you
a
look
good
at all the
answer?
research, yeah, I think that's a great answer. And I think that what people don't realize sometimes is that when you fit in a hearing aid, you're using basically a mathematical formula to work out how much power to deliver back to the patient. And sort of a fundamental flaw in some of these formulas is that you're expecting everyone's ear canal to be exactly the same size and shape, and not to have lumps and bumps and curves and twists and bends. And all those things have an impact on the sound that comes out of the hearing aid. So, I mean, from what we do, obviously we do objective testing called relay measurement. When we're doing those tests, we can see that a lot of the hearing aids are, way off what the prescriptive formula is telling you is happening on the screen, and you'll get lots of over amplification at some frequencies and under amplification at others. And that's why it's really important that when you're looking to get hearing aids, that you find out, does the clinic you go to do objective testing on the hearing aids? Are they fine-tuning those hearing aids for each individual ear canal as well? It makes a massive difference. And all the research says that those patients do so much better when processing sound in speech and background noise and those things. So it's a massive thing. So yeah, that's a brilliant answer, and I think it's worth people knowing those things. What have we got here? So Margaret Pickburn, how can I clear the eustachian tube? It's driving me mad. Thank you. Okay. Right. So
that one first.
I'll have a go at this one, guys. So when we're talking about when you talk about clearing the eustachian tube, what you're actually talking about here is more clearing the middle ear space. So which is the space that sits behind the eardrum, contains the three little bones of the middle part of the ear, and that space is lined with these mucosal producing cells. So what can happen is we produce a mucus in that space all the time because we want to keep it nice and clean. We don't want any infection happening in there. So it's almost like a flushing mechanism, if you like, for a very simplified version of that. It's a flushing mechanism. And we yawn, swallow, chew, that all drains away and air goes in to replace it, and we keep the pressure all equalized. So if you want to clear that sort of middle ear space, a really good way of doing that is something called the Valsalva technique, which is where you pinch your nose and very gently try and pop your ears. That's a really good one. Sometimes using just decongestants and things like that can help to improve things. 9 times out of 10, it will just resolve itself over time anyway. It can take a good few weeks to resolve itself, but yeah, so that happens quite a bit. Anything you want to add to that one, Conor?
If it hangs around for longer than a couple of weeks, there are a few things you can do to help yourself along before going to the doctor. One of those things would be you could try like douching your sort of nasal cavity or nasopharynx with like a saline solution. So you can buy stuff from the pharmacy called Neomed, or I suppose you can do it yourself, but boil the water first and let it cool.
Yeah.
Or you could try some decongestant nasal spray. If you're going to use like a decongestant nasal spray from the pharmacy, try not to use it for more than like 3 days, because the way these nasal sprays work is when you spray them up your nose, whatever tissues the spray contacts, it will constrict the blood vessels in the tissues. If you use it for too long, you'll get something called rebound, where your sinuses start to engorge the tissues with blood. If that doesn't work, go to the doctor and they can give you some steroidal nasal spray, or more importantly, they can refer you on to like an ear, nose and throat doctor, and they can put a camera up your nose and see why the eustachian tubes aren't opening properly.
Yeah, it's a good answer. I hope that answers your question. Okay, so we have absolutely amazed by both of your talents and your knowledge. Do you watch each other's wax videos on YouTube, and do your partners watch your wax videos and all like we all do? Thanks. Yeah, I certainly do. I watch a lot of the guys on YouTube, and I've learned a lot as well, because you're never too old to stop learning. And there's lots of bits and pieces that I pick up from Conor's videos, from Neil's videos, from Richard's videos, even just techniques, and just looking at how different audiologists approach things. We tend to work in quite, I don't know whether you feel the same, Conor, you're kind of like an insular kind of, you do your own work, you don't really tend to look at other people's work too much in normal practice. So having those YouTube videos really does help as a reflective practice for us, and seeing everyone else's. What about you, Conor? Do you watch anybody? So are you...
Yeah, so I watch you guys. I watch Richard Isherwood, who's the wax wizard.
Yeah.
I watch Neil. I've also been, weirdly enough, checking out Zone 1 Hearing, who's also a really nice guy who owns that company, and he does some informative videos as well.
Yeah.
No one else watches them with me, They just don't understand me. But yeah, it's nice to kind of just see each other's cases
Yeah.
and just again learn from each other. So yeah, we're not like in competition with each other or anything.
No,
So
no.
yeah,
It's quite a
I
friendly
do learn quite a
community.
lot.
You do.
Yeah,
Yeah, you do. Yeah, we all kind of get on quite well, and we all speak to each other every so often just to touch base and make sure we're all doing okay. So it is quite a nice little. There's no kind of, there's a lot of camaraderie, I think, within the audiology social media kind of channels and arenas and things like that as well, which is always lovely.
yeah. It also kind of ups your technique a little bit. I
Oh
remember
yeah,
when there was a video that you guys did it maybe like 3 months ago,
yeah.
and I saw Taylor. He took some wax off the eardrum with a Jobson horn.
Yeah,
I don't know if
that
you
was.
remember that.
Yeah, I do,
That was
because
intense.
Taylor's like the curettage king. He can, do you know, the things he can do. He's gonna love this. I know he's in the comments as well. But he is so good with those curettage tools, and he is pinpoint accurate as well, which is. I mean, I was looking at it thinking, well, fair play. I don't even know whether I could have taken that off
Yeah,
that eardrum. And he can just find gap. I mean, this is why he loves the Rosen inserter so much. He can just find a gap in anything and exploit it. So he does really well. And
yeah,
I think
yeah,
certainly with Connor's videos as well, you know, you are so good with at explaining quite
thank you.
complex medical terminology and medical conditions, and just putting them in a way that makes it really accessible to everybody. So like, you know, when I'm watching and think, actually, I've never thought of explaining something that way, or I've never looked at it that way before, and I find that really, really helpful. And I know there's a lot of other people out there that watch your videos and find it really helpful as well.
Cheers, Rhys.
That's all right.
So much love
I know, because so what else we got? So, oh, go on, Conor, you can read this one. Go, I've read them all. Go on.
Yeah, this is from Rhiannon P.
Yeah.
I have about 30% hearing in one ear and 90% in the other. If I get hearing aids, isn't that like standing next to a speaker and will ruin my ears faster? Definitely not. For this, I mean, I appreciate that if you have 30% hearing in one ear and that's the bad ear and the 90% ear is your good ear. Single-sided deafness is difficult to treat
Yeah.
because the bad ear is always going to feel a little bit laggy or unnatural. However, you're in no danger of your ears being ruined because modern hearing aids, they have something called compression and limiting. It's exactly the same technology that you'll find in like a music studio or a mixing desk or something like that. So it means that the sound cannot go above a certain limit, and that limit can be set by your audiologist. So, you know, if you're wearing a pair of hearing aids and, you know, a loud truck goes past, that compression will kick in very, very quickly and defend your ear from getting blasted too much. So there are plenty of safety mechanisms around for that. You'll be fine.
Yeah, it does make a big difference, and you know, and this is where we talked earlier about your properly fitted hearing aids as well, and that's why it's really important to get your hearing aids, you know, properly, for want of a better word, tuned in. Then, if you like, to your hearing loss. But yeah, you'll see a massive difference. You really will. Yeah, you really will. Oh, have we got some more questions? Let's have a little look. Oh, there we go. So thank you both. I was given antibiotics. Oh, so this is from Margaret Pickborn. Sorry. Thank you both. I was given antibiotics recently. Obviously, they didn't work. So I've been doing the nose holding, like being on a plane to clear it. We'll try what else you said. Great advice. Oh, great. I'm glad we could be of help there, Margaret. So I'm fingers crossed that will clear itself up for you as well. And let's have a little look. So Jan Deason from YouTube asks, why does my earwax smell? Earwax in itself normally doesn't smell, from my experience. I mean, if we're talking infection, no. I mean,
maybe we're just desensitized to it.
Perhaps that's what it is. Yeah, we're so used to it, we just don't smell it anymore. I think that in some cases, if you're looking at maybe like underlying infection or other issues, that you'll certainly get a pungent smell. I think that the only time I've ever smelt the earwax kind of on its own, it can have like it sounds a bit gross. I'm going to put everyone off there, but unwashed hair. It's got that kind of smell to it. That kind of it's a bit of an odd one. That's the only one I can see. What about you, Conor? Have you come across smelly earwax?
I know what you mean about the unwashed hair thing. sometimes it does have that slight aroma, but typically it
Yeah,
doesn't smell that
no,
much to me. So I'd maybe get it checked out.
yeah, definitely. If it's smelling, it's not usually a good sign. So get a professional to take a look at that. What have we got? Oh my goodness me. So Tracy Mason 4761 from YouTube said, I had my ear suctioned last week, and since then my hearing has been extra sensitive. Even if my grandson talks too loud, it hurts. And also I can hear what I think is my heart beating in my left ear. Is any of this normal, please? Do you think could be looking at possible mid-ear effusion there, maybe something like that going on? Um, oh, yeah.
Sorry for
Connor's coming back. He's lost his leg.
It's not normal.
No.
It's not a disaster, but it's not normal. I mean, typically, if you have pulsatile tinnitus, which is hearing your heart beating, I mean, that's fine if it goes away, but if it keeps
Yeah.
coming back over and over, or if it's constant, then that would worry us a little bit. So
Yeah.
that would mean that you would need to see an ENT doctor, and they might order an MRI scan or a Doppler,
Yeah.
which is an ultrasound of your neck, or they might order an MRA, where the A stands for angiogram. So they inject you with dye, and then they can put you in the scanner, and that would illuminate all the blood vessels in your head. Because if you can hear your heart beating, that sort of implies that there's some turbulence going
Yeah.
on. Now, anecdotally, normally when I refer someone for pulsatile tinnitus, or they can hear like a shh, 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 something like that, normally it comes to nothing and there's nothing wrong and it eventually goes away.
Yeah.
But it's not quite normal. And I think you should go to your GP and get a referral, because something as simple and uninvasive as microsuction shouldn't be causing pulsatile
No.
tinnitus.
No, not normally. And about the sensitivity we talk about there of sound as well. You don't normally tend to get a sensitivity to sound. Obviously, if the wax is long standing, it's been there a long time, it's been blocking the ear canals, you can sometimes get almost like a hyper awareness of sound after you clear the wax out. You can hear things. People say they've got super hearing for a little while afterwards, but normally that settles, and it normally wouldn't be a discomfort as you're experiencing there. So yeah, definitely GP and get yourself checked over. Just get a medical opinion on that one as well. Oh, you can do this one, Conor. I didn't read this one yet.
Okay. Stephen from YouTube asks, hi, every once in a while I get a single tone, high-pitched noise in one ear. It lasts for about 10 to 20 seconds, then fades to nothing. No wax, no other tinnitus, just this rare occurrence. Thoughts? What do you think, Rhys?
Perfectly normal. This is just the ear doing its thing. You get this a lot, and sometimes it can be a ringing. Sometimes you can get all sorts of different noise. I get it. What I get more commonly is it almost sounds like there's a dullness to my hearing for a couple of minutes, and it just goes back to normal again. So it's just the ear doing its thing. It's just everything working as it should do. You get little sort of glitches in the filter mechanism inside the brain, and it can cause this, and then it clicks it back in again. So I've got no concerns. What about you, Conor? What would you say?
I know exactly what the guy's talking about, because I get it sometimes. In
Yeah.
fact, oddly enough, a lot of people worry that they have this myth that if they hear this thing, like that specific pitch, then that means that there's something dying and they'll never hear that pitch again.
Yes.
But
Yeah.
that's not true. I actually don't know why it happens. I have no idea why it happens, but it's not harmful. You have nothing to worry about.
Yeah. Okay, so YouTube Just PP said, my partner has NHS hearing aids and struggles to keep up in group conversations because he feels that the noise is coming from behind him. Any ideas? Oh, I mean, I think we'll both tackle this one because we both got it. Because when I worked in the NHS, the hearing aids they fit on the NHS are good hearing aids, and the NHS do a fabulous job. And the difficulty is obviously with the NHS here in the UK, you're trying to fit as many people as you can with as little cost as you possibly can. So the technology inside the NHS hearing aids does tend to be a few generations behind what's available privately. I would say in these group conversations and they're hearing lots of background noise, sometimes I would go back to your NHS supplier and just say, explain that situation to them. Sometimes they can put different programs or different settings on the hearing aid. They can activate things more like directionality and stuff like that. Might help with some of the issues that you're getting. So yeah, I would say definitely go back to your NHS supplier and have a chat with them. See if there's anything you can do about changing some of the settings inside the hearing aid to help out with that background noise situation. Anything you can add to that one, Conor?
I mean, I would concur with what you said. The hearing aids generally are of a high quality that are provided on the NHS. If he feels like he's struggling in group conversations, I'm not overly surprised, because that's quite a common complaint, and
Yeah,
it's more to do with the dysfunction that's going on inside the cochlea. And as you get older, you lose the sort of ability to tell the difference between certain frequencies, or in other words, you feel like certain keys on the piano are the same pitch. It's that kind
yeah,
of dysfunction inside of the inner ear. You could always try cleaning out the hearing aids or the mic ports of the hearing aid. Maybe the
yeah,
forward facing mics are blocked, but broadly speaking, yeah, you should go back to your hearing aid provider and see what they can do for you. There's probably
yeah.
something that they can do for you, I would imagine.
That's it, and I think if do try, because we always advocate to people can try NHS hearing aids. They do suit a lot of people. There are a lot of people wearing NHS hearing aids out there, but that is why there is also a private market as well. Is because the NHS hearing aids don't always suit everybody, and sometimes trying something that's available on the private market, you might find that works better for you. So it's worth maybe trying that sometimes as well. But first protocol, definitely back to NHS. Yeah. At Audiology Associates, 8-year-old autistic child with clogged ears, sensitive to sound, olive oil and water do not help. Now, this is tough. It's always a little bit more difficult. I mean, you see pediatrics in your clinic as well, Conor?
Yeah, yes, we see kids down to about the age of 2 years old in my clinic
Yeah,
for wax removal. Yeah.
yeah. When you've got somebody that they do have a sensitivity to sound, it is really difficult. We've had children that sometimes come into clinic and they come and meet us first. They have a look at the room. We start the machines up so they get to hear it, and they get to it's getting them acclimatized to the environment they're in. Sometimes that can help, but difficult with sensitivity to sound. I think microsuction might just be a little bit too noisy for them. So it is hard. There are other drops you could try, over-the-counter drops and things that you could try out as well that you might find help. So if you've been using some olive oil, sometimes things like sodium bicarbonate might just help to loosen it a little bit more. Anything you can add on that one, Conor?
I sympathize. I mean, sometimes this is going to make me sound like a really horrible, but sometimes if the wax does need to come out, sometimes you can hug the child's
Yeah,
head into your chest, and whilst the procedure is done as quickly as
yeah,
possible, but it is extremely distressing for the child, and sometimes we do have to bail if the child's in too much distress.
yeah,
As a last resort, you can have the child can be sedated in theatre, and the
yeah.
ENT doctor can take over, but they typically don't like sedating children for that purpose.
No,
In other words, if many different practitioners have tried it and it's still not working, then the doctor would probably give the child 3 months of Sofradex, and if that doesn't work, then they'll have to be sedated.
yeah,
But I would add to what Rhys was saying that a lot of the time with these children who are extremely distrustful of professionals
yeah,
is that if you lay the ground properly and you show them all the tools, and if they like you, then they're much more likely to comply and sit still while you do the procedure. So you just
yeah.
have to go to a professional who is used to working with children and understands their needs.
Definitely, definitely. And like I said, we get lots of children, we invite them in, and they come in, they meet me, and they see the room, and that does make a big difference for a lot of kids. It does sort of help them to feel more at ease when they're coming through. And sometimes we even get them watching the videos, and that's one of the reasons that I know clinics like Conor's and ourselves as well, we started putting those videos out there just to show people what happens. I get lots of pediatrics who come through, and they'll ask you, am I going to be on a video? Or they'll go through it and they'll say, oh yeah, I've seen this and I know what you're talking about. So it does help to demystify a lot of it before they come into clinic as well. So that does make a big difference. Yeah. Ooh, sorry, I got something in front of the screen. Hi gents, I enjoy both of your channels. Why does the top of the mouth tend to tickle when one has a buildup of earwax? Now, you did a really good explanation of this because you were talking about all the nerves passing through the ear canal, or the branches and nerves and bits and pieces. And that was really interesting. So do you want to tackle this one, Conor?
See if I can remember what I said.
Sorry, I put you on the spot then, didn't I?
It's all right. I mean, I don't know. Probably it's a stimulation of your vagus nerve.
Mm.
I don't know though if that supplies the top of the mouth. I
I
think that's
don't
a
know.
glossopharyngeal nerve.
Yeah,
Um, Although I guess it could be an interaction. I don't know. But essentially, what I think is the answer is that you have various nerves supply the ear
Yeah.
canal and ear, but one of them is called Arnold's nerve, and that is branching off of something called your vagus nerve or your 10th cranial nerve. To put it bluntly, there are lots of nerves that come from your brain and then supply the body. Okay. Probably the most interesting one, which goes all the way from your brain right down through your chest to your abdomen, is called the vagus nerve. And sometimes when you ruffle up the ear or you removing wax or whatever, you'll stimulate a branch of that big vagus nerve, and that can make people cough or gag, or in your case, clearly it tends to make the top of your mouth tickle. So I imagine that's what's going on. Yeah.
Yeah. I always say, yeah, I could agree with everything Conor says. I think that sounds exactly what it is. And this is why we get that cough reflex when we're taking wax out of people's ears or stimulate a particular part of the ear, you get the cough reflex as well. Go on then, Conor, you can do this one.
So, Esther D. So on.
Vroge, yeah.
Yeah, Vreg, maybe. I use earplugs at night. My husband snores so loud, but I have perforated eardrum and fluids come out. Is it wise to keep using earplugs if it's blocking a perforated eardrum? Not great. Okay, interesting question.
Yeah.
Will that one please?
Yeah, I think it would depend on the history of your perforation. I think if you've got a very well-behaved perforation and you don't suffer with infections, and by using the earplugs, it's not really causing any issues, I think you're probably absolutely fine to use it. What you get seeing with the fluid is basically, we talked about that mid-ear space and those sort of mucosal producing cells in there. Well, any fluid is going to try and find the path of least resistance out of the ear. So if it can find an easier route than trying to travel down your eustachian tube, it will naturally come through the perforation into the ear canal, and that's what you can see. But as long as it's not causing any irritation to the ear or it's triggering off infections, I think you'd probably be absolutely fine to use it. Maybe just sterilize them every so often, just to make sure they keep nice and clean. Just give your ear a break every so often, maybe just to let it dry out a little bit. But apart from that, anything else you want to add, Conor?
I think if it's not been investigated, your husband would see a doctor about his snoring.
Yes, that's another option.
Not going to harm him.
Yeah.
The snoring isn't going to harm him in the short term, but there is a belief amongst some doctors that if you snore loudly and profusely, that will eventually lead to sleep apnea. Or maybe he already has sleep apnea. Does he go like this? Does he take long pauses when he's sleeping? You should get that checked out.
Mrs. B is nodding in the background here. She's looking at me because I snore.
Broadly speaking, I agree with Rhys. As long as the stuff that's coming out of your ears isn't smelly or goopy or gooey or green and stuff like that, and it's just like moisture or sweat, then that's fine. But I would strongly suggest you see an audiologist to get some custom-made ones made, custom-made sleep plugs, and they'll be better for you.
It does make a big difference. Yeah, it does make a big difference. So Stephen on YouTube. Hiya, Stephen. Why does long-term exposure to cold water cause swimmer's ear, and why is it always three? Now, Steve's asked me this loads, and I couldn't find the answer to this at all anywhere as to why we get the 3 bumps when we look at swimmer's ear. Why is it always 3? I did a bit of background research because he's asked me this question before, and I couldn't find an answer out there that says why you get those 3 bumps. Have you ever come across why we get the 3?
I've seen more than 3 and less than 3.
Yeah.
But I do agree with you that generally it's more than 1 and less than 4.
Yeah.
As to why does it happen, or why do you get 3?
I think Steve, when Stephen asked me before, I think you want to know why do you get that sort of roughly that 3. So obviously we know why you're laying down those extra bit of bone underneath, because is it microfissures inside the bone that causes this part of it, which is what caused it to lay down, Conor? What caused you to lay down and get the bumps in the ear canal?
I don't think it's microfissures. You would get that with keratosis obturans or trauma or something like that over a long period of time or extended period of time. I think probably what happens is that when you swim in cold water for a while, obviously that really constricts the blood vessels in the epithelium. And then underneath the epithelium, you will have periosteum. Peri means on top of, and then osteum means bone. So all the bones in your body are lined with this kind of cling filmy tissue, which is periosteum. And I imagine what happens is that the blood vessels are constricted for such a long time that creates a little bit of trauma. And then the periosteum, all of the osteoclasts come out of the periosteum and start laying down bone. I think it's probably 3 because, again, the cold water's going in, so it's like a diffuse irritation of that periosteum rather than just a single point. So I'd imagine that's why it's 3 and not just a single one.
That's our best answer. We agree there's no definitive, but that's what we think is going on there, definitely. Right. So you can take this one if you want, Conor.
Kim from YouTube asks, why don't you show the tanks at the end of your videos? I would like to see them. Thanks for tonight. People just showed widespread disgust when I did it.
Yeah, they were.
They
were saying with us, I think it's just the mixture of the water and the wax. It just goes all gloopy and it just doesn't look particularly pleasant. And there were lots of very green-faced emojis popping up on comments after we started showing tank shots, which is why we don't tend to do it anymore, because people don't tend to like it very much, unfortunately. Yeah. But you're more than welcome for tonight as well, Kim. It was it's lovely for us to get together, actually. Ooh, what have we got next? Okay, gentlemen, is it also suggested that if you have difficult problems that you see your GP, and if you're having medical and auditory issues and not say, well, Conor and Rhys said they're not seeing you? I think what you're saying here is, when do you go to a GP as opposed to maybe seeing your audiologist? I think that's why I'm reading this anyway. But basically, what I would say is that historically, as audiologists, we're classed as technically trained, and if we want further investigation, we need a medical opinion a lot of the time. Now, we can refer back to GPs. Some ENT consultants may accept referrals from us if we work really closely with them as well. But a lot of the time, if it's something that we feel we need to get a medical diagnosis for treatment, then we will certainly be referring you back to your GP as a first point of call, and they can normally refer to ENT if we don't work with them directly. I think is that your read on that question as well, Conor? Would you say that's what's being asked, or am I misreading that one?
I think so. I mean, broadly speaking, if your issue is just you have hearing problems and there's no pain, vertigo, facial pain, and weirdness, if it's just you can't hear very well, or you have tinnitus but in both ears, then that's fine. Go and see your audiologist, because that's not really a medical issue per se. It's quite normal actually for you to lose your hearing over time and have bilateral tinnitus. So, but if you do have pain or facial tingling or something like that, then it's a doctor's job.
Oh, definitely. Yeah, definitely. Everybody now is saying they want to see tank shots, Conor, so we're going to have to start including some tank shots. I know. I thought it was strange because that was really unpopular when we did it before.
Right. My tanks are usually pretty full. They're pretty good.
I got tank envy now, Conor. So what are your thoughts with checking your ears at home? I have a friend with a 3-year-old deaf son, and he uses the B-Bird system. What are your thoughts on home extraction, Peggy in Texas? Now, you did a video about B-Bird, and B-Bird have sent us some stuff to have a little look at as well. What are your thoughts on the sort of these well, they're kind of like home wax extraction video cameras. I mean, what are your thoughts on those, Conor? What do you think?
Personally, I don't mind them if they're just used as cameras. I mean, I think it can cause a lot of anxiety. Yeah. I mean, if you go to like the subreddit, the earwax subreddit, you see a lot of people taking photographs and freaking out over normal anatomy.
Yeah.
However, some of my patients have these cameras, and it's very useful for me to see the pictures they take.
Yes.
Are they good at removing wax? As a professional who's tried with a few different devices that I've not uploaded to YouTube, they are very difficult to wield safely and effectively. And what I ended up doing was just hurting myself and pushing wax further down. So I'm not a huge fan of them as like extractors, but as cameras, I don't mind them.
Yeah, I agree completely. I think it's a great way of checking your own ears. And we said that there was a lady earlier that said a son who was getting distressed with wax. Taking a look, do that in the comfort of your own home without taking them to a clinical environment. Great. I think for looking in ears, it's a fantastic little tool. And I think the difficulty is that, I don't know whether you've experienced this, Conor. We get lots of people sending us images from these cameras, and everything always looks really dark and really dull. And they, like you said, they panic because it's not looking really shiny and pleasant as it normally would. But what you got to remember is what you're looking at with our cameras is a medical grade endoscope, and what you're looking at there is just a little camera that looks inside the ear. So they are always going to look a little bit different. Perhaps we should do a video, Conor, where we kind of put up, this is what it looks like with this camera, and this is what it looks like with the endoscope, and this is perfectly normal. So yeah, we shall see how it goes.
Yeah.
Do you want to do this one, Conor?
So Diana asks, I have been in a wheelchair for several years and now I get dizzy much more quickly now. Why? Right off the bat, I would suggest that dizziness is typically very difficult to diagnose, even if you are an audiovestibular physician or a consultant with years of experience. Dizziness is often extremely difficult for your GP to deal with because dizziness can be, well, if it's spinning like you're drunk or you know whatever, then that's, I guess, not too bad in the sense that it implies that it's ear related. But if there's no turning or rotation, then it's much more of a kind of, okay, is this blood pressure or is it something neurological? Is it, you know, your eyesight and so on and so forth? Is it just when you're moving, in which case it could be postural hypertension where your blood pressure drops when you're moving? I'd imagine maybe if you're sitting in a wheelchair all the time, and then you get up to go to the bathroom or somebody helps you up, and your blood pressure could be dropping. However, this is now a recent thing, then you should absolutely see your doctor.
I think people they don't realize how many mechanisms are involved in balance and keeping us upright and our balance working well. And there's lots of different mechanisms all working together. And if you've got a slight weakness in one of those mechanisms, usually the others can cope and they can sort of adapt. But when you get stuck in weaknesses and a few more, it can really start to cause some problems. So as Conor said, it's really difficult to diagnose, without lots of batteries of tests being done, other bits and pieces to get to the bottom of it. Ooh, what have we got next? Can TMJ cause ear issues? I typed "eat" the first time I sent this question. This is from Megan. This is in the YouTube. We love autocorrect. It can certainly cause. You can certainly get referred pain from TMJ into ear. I've had that before. Would you really cause it? I don't know if it'll cause ear issues as such, if it's just TMJ pain more issues.
Not really. Let me just turn the light on.
That's all right.
I mean, I can see why you would think that, because the TMJ or temporomandibular joint is what she's referring to, because that's the mandible, your lower jaw, and this is the temporal part of your skull. So that's the joint between the interface between the two. And generally speaking, if you look at a skull, the jaw joint is basically next to the ear canal. And what happens is if you have dysfunction of the jaw because you're chewing on that side due to dental issues, or you're clenching or grinding your teeth during your sleep, if that jaw joint becomes unhappy and inflamed, the brain can't tell the difference whether it's ear pain or jaw pain, because the nerves that supply those two things are basically the same. So it can give you a sense of ear pain or ear fullness, or make you feel like there's something in your ear, but it doesn't actually harm your ear unless you have a really, really rare condition where the jaw joint is prolapsing into the canal. That is so rare that it's probably not what you have.
There you go. I hope that answers your question. Let's see. Is it normal for my ears to pop almost every time I swallow? This is from Big Fezzig from YouTube. It's not normal if it's happening every time you swallow. It is common when we yawn, swallow, chew. It can happen. Shouldn't be doing it all the time. Do you think it could be like an opaque eustachian tube, possibly, or something that's just maybe? You get with breathing, I suppose, more with those kind of things as well, don't you? You get with intakes of breath, you can get alterations.
Yeah, I wouldn't worry too much about it. I would only tend to worry if the pop is just happening when you're not doing anything or not swallowing and just being yourself. Or I would only tend to worry if it was like a weird squelching or crackling, or you could hear yourself breathing, or so on and so forth. If you just get a pop when you swallow, I wouldn't worry too much about it.
Yeah. Loads of questions coming in, Conor. There's lots of people saying this is a great thing to do. So fingers crossed, if you guys
Oh,
do
awesome.
enjoy this, then perhaps we could get together again. If you'd like to see me and Conor together again, and Taylor, yeah, because the lovely Mr. Taylor Greed is not on your
Yeah.
screens today, unfortunately. But fingers crossed, we might be able to get him on at the same time with all of us together. So if you'd like to see us back again doing something like this as a collaboration, maybe getting Richard the Wax Wizard on as well, try and get Neil on, try and get loads more people, try and get a few more of us on the screen at the same time. Then yeah, just let us know in the comment section. That's something we'll definitely do for you.
Have to behave.
What do you mean I'd have to behave?
We all have to behave.
We'd all have to behave. It's Conor you want to watch out. It's not me. So I've never had my ears clean before. Sometimes my right ear, if in the car and music is playing, sounds like static. Best way I can explain. If music is low, I'm good. Ears itch a lot. Why, there's a lot to unpack in there. Tiffany Moon from YouTube. Where's this? Right, okay, so let's break this down. So if the car music you're playing, it sounds like static. That's a bit of an unusual one. Potentially, best way I can say, if music is low, I'm good. Oh, okay, right. So we're saying if the music is at a low level, we can hear it really, really well. But if the music is loud, the sound alters slightly, so we get a bit of static sound. So we could be doubtful. We might be hitting sort of uncomfortable loudness levels. Maybe are we looking at reflexes kicking in, possibly? But it normally wouldn't give a static sound, though.
I don't know is the answer.
Yeah.
I mean, obviously, I guess the first thing that would come to my mind is, I don't know, I guess the simplest and meekest thing would be, is there a little bit of debris or wax sort of in contact with your eardrum, which is making it vibrate weirdly? Or do you have eustachian tube dysfunction on that side?
Yeah.
Which is, again, as Rhys has alluded to, that there's a pressure difference between the nasopharynx and your middle ear.
Yeah.
If both of those things are ruled out, then I would be doing a hearing test and finding out what the heck is going on. There is sometimes, if you have an underlying hearing loss and it's really, really bad in the higher frequencies, you have a ski slope hearing loss, and that can sometimes lead to distortion of your hearing. But I think that's relatively rare, and that's probably not what you have.
No.
You should first go to your audiologist and get your ears examined.
I mean, how often would you recommend somebody goes to an audiologist, Conor? I mean, we talk about the hearing loss is such a common thing for people, and it affects so many people. And when you look at the research and the statistics saying how long it takes from somebody to get their initial diagnosis of a hearing problem to getting help with their hearing and trying to catch people earlier. So what would you say would be a good timescale for getting people back and forth to get their hearing tested?
I mean, essentially, as soon as you even suspect that, something is wrong, because if essentially, if there's something, wrong with your hearing, but it's not necessarily a medical issue, or it's not worrying the audiologist, then they can treat it with, wax removal or a hearing aid or something like that.
Yeah.
And we now understand that it's, generally speaking, much, much better for the health of your brain to get treated with hearing aids and resolve a hearing loss earlier, sooner rather than later. But if there is something wrong and you need the attention of a doctor, we can sort of arrange that for you. We can write to your GP telling them what's wrong, or tell them that we don't know what's wrong.
Yeah.
And then they can take over. So in other words, it's, the audiologist can take care of you. So you should just present as soon as there's a problem, sooner rather than later. Is the modus operandi.
I think as we age a little bit, it's worth, you get your eyes tested on a regular basis. It's worth getting your ears just checked out every so often, even if it's just for a baseline test, and then we can advise you from there. We might say, well, look, everything's looking normal, come back every other year or something, we'll get a test, and it's worth doing that sometimes as well. Right, what else have we got? Go on, Conor, you can take this one.
So Rhiannon P, this is your second question, Rhiannon. Keep them coming. Okay, this is going to sound crazy, lol. But if you have a perforated eardrum, does that mean there is a channel from risk brain infections?
Oh, okay.
Is there a channel that would risk brain infections? Okay, understood. You want to fill that, please?
Well, the short answer is no. You can have a perforated eardrum, and it can be, as long as it's healthy, it's not getting repeated infections and things like that, you're absolutely fine. If you had complications where you were getting repeated infections, and there are some conditions that can sort of intrude into the middle ear space, they can cause some problems where there may be a risk, but it's such a small risk and very, very rare. I would say if you've just got a long-standing perforation that's very healthy, no, you'll be absolutely fine. If you get repeated infections or lots of other sort of medical issues with that as a result of that perforation, then you need to be a little bit more careful with perforations and get them checked on a regular basis. Anything to add to that one, Conor?
I agree with what you're saying. I mean, the risk is just infinitesimally small.
Yeah,
I would only worry if you had surgery of some kind to your ear,
yeah,
or you had a mastoid cavity, because what can sometimes happen is that the surgeon, unfortunately, will leave a little bit of your dura exposed when they're making the mastoid cavity, the dura being the outer layer of the brain. But that would be the only time that I would worry. So
yeah,
generally speaking, you'll be fine, and the risk of a brain infection is just not going to happen unless
yeah,
you've had really extensive intervention.
definitely. Okay, so last time posting this. Sorry, we must have missed this on the way through. Sorry, Tammy. Last time posting this, but have you ever encountered a patient with a tube lodged or fused behind the eardrum? I have one out, but because it never bothered me, the doctor never removed it. So I presume we're talking about grommets and things like that this time. So there are tubes that we pop into the eardrum, which are called grommets, which we use to treat middle ear effusion. It's very common in children, those kind of issues. But they do tend to fall out as the eardrum repairs itself. It gets pushed out into the ear canal. And most of the time it will just fall out and you'll never know it's fallen out. There are people with sort of chronic middle ear issues, and sometimes, again, we always used to refer to them as T-tubes, but I don't know what they call them these days, Conor. They still refer to them as T-tubes these days, Conor? The more sort of
Yeah, I
anchored
think so.
drainage tubes.
Yeah.
And they are designed to stay sort of fixed in place so that they create that sort of flow through the eardrum, allow the drainage of fluid a little bit quicker for people with chronic middle ear fluid issues. Have you ever come across? I heard a story once about an NHS audiologist who took a very deep impression and took a T-tube out on the end of the
Oh,
sponge
goodness
of the
me.
impression. So that's always sent shivers down
Wow.
my spine when I look at that one. Yeah,
God, that must have hurt.
yeah,
I've only ever seen it, once where somebody had a grommet in when they was like, 10 years ago, and they forgot about it. And
yeah.
by the time I saw them, there was tissue growing inside of the grommet. So it was
Wow.
actually the body was starting to grow around it.
Yeah,
It's not a massive problem, but essentially the patient had to be numbed up and it had to be basically be cut out,
yeah,
which is not a disaster because then you just once it's cut out, then the eardrum should heal within about 10 weeks, and it's not a problem. If it doesn't heal, then the surgeon can do laryngoplasty where they graft the hole. But T-tubes, as Rhys alluded to, they stay in for much longer. They're supposed to stay in for about 4 or 5 years, but then they're
yeah.
supposed to be taken out.
Mm.
So if you've had a T-tube and it's not been taken out, then you should just follow up with the ENT
Yeah.
doctor.
Yeah, because people do fall through the gaps, don't they? You do kind
Mm.
of you do find people will drop off lists, and not for no fault of their own. It does happen. Yeah. Go for it, Conor. You can read this one out.
So Holly says, any way to tell wax removal needed versus hearing loss? Not really well by
No.
yourself. You should have a professional to consult a professional.
Yes, definitely. I think it's. I think if especially if you notice, if we were talking about wax problem, usually people notice it as a sudden change in their hearing. So sometimes you get a very gradual change, but a lot of the time it will just suddenly seem to plug up, and that's when I would really urge somebody to come along and get a hearing test done. Because if we're looking at any sudden change in hearing, it's really, really important that they get an appointment as soon as they possibly can, either with audiology or with GP, something like that, because we want to rule out whether we're looking at a wax problem, or whether we're looking at a sort of a sudden sensory hearing loss, which can be far more problematic. And really early intervention for those types of hearing losses is crucially important. So yeah, I think you definitely get that assessed. If you get any change in your hearing, you should be coming along to an audiologist anyway. There we go. Can rheumatoid arthritis affect the ears? Now that's a good question, Conor. I've got no experience of this. Have you got any experience of this either?
Not really. My instinct is telling me rarely.
Yeah.
I mean, I understand the kind of where the question is coming from in the sense that can it make your ossicles kind of
Yes.
weird and malformed and stuff. So possibly, but I don't really see it that much. I don't see a huge
No.
association with it.
No, I would have said this. I would have said exactly the same. Yeah, I would have said exactly the same. Ooh, we're down to the last 10 minutes, guys. We're on here for another 10 minutes. We're coming off at 8 o'clock. So if you guys have got a burning question that you really, really wanted to ask Conor or myself, make sure you get into the comment section so we can take a look at it. Hello, Rhys, Conor, and Taylor. We can't get suction in the US. What can be done that is comparable? I get itchy ear canals once in a while and it drives me crazy. Now, the US health market, I suppose you would call it, is very different here in the UK, and I think it varies so much from state to state. From what I can see on the chats that we get, as far as comments on YouTube, because if I did have a chat that came in from New York, and he said that it was really difficult to get suction in the US because you had to get almost a referral, a bit like you do here in the UK, almost to an ENT consultant to get that done. But then I had loads of people in the comments saying, well, no, I can get that done really easily through my local medical provider. So what I would say is there anything comparable? You can, I think irrigation is probably one of the most common types of earwax treatment in the US. It might be a little bit of an issue if you get itchy ears. You want to make sure you maybe we use ear calm over here prophylactically afterwards, just to make sure everything settles back down after irrigation's been done. Can you think of anything else here, Conor, for that one?
I mean, the state to state thing, I believe, is correct. I think
Yeah.
the only state that I know of where audiologists can do suction in the US is Texas. There's
Okay.
probably a few more, but it does vary. And in the States, they're a much greater fan of irrigation or lavage,
Yeah.
as they call it, which, in my opinion, is okay as long as the practitioner is skilled and you obviously you haven't had like 3 perforations and the eardrums healed back super weak, or you haven't had an operation, so on and so forth. I think the most important part is to be a skilled practitioner. Regarding the itchiness, it's probably either your ear is too dry because you don't have enough wax, or you've got some underlying dermatitis or something like that. Again, best thing to do is not take a chance and see a professional.
Yeah, definitely. At Audiology Associates, or Conor, had my ears microsuction recently, was told to now use olive oil drops fortnightly. Can I use shop bought virgin olive oil, or does it have to be medical grade? That's from Susan in Surrey. Medical grade, please, Susan. Is it really easy to answer for a change? Please don't use shop bought virgin olive oil. The olive oil you get in the medical grade is just been filtered and treated a little bit more, so it's safe to use in the ears, basically.
Okay, we're going to just
Yep, I can go.
the last 5 minutes. I'm just asking for.
All right. Okay. So lots of people are asking for shout outs. So we've got about another 2 minutes and we'll start doing some shout outs. Yeah. Okay. So 5-2, we're going to start doing some shout outs for everybody. Right. What's next? There's been some really good questions in here tonight. Normally it's kind of quite light and fluffy, but everyone's really getting into the nitty gritty of it today, which is lovely. Go for it, Conor. You can do this one for us.
We've already had this question, actually.
Oh, we have.
Yeah.
That's right. Yeah, we've done that one.
Apologies.
That's all right. We're going to look for another one that came up because lots of people sending questions before we went live tonight. So we're just going to take a little look at some of these. We're just going to look for another one now. And right. Kirsty Cruzu from YouTube asked, love to know what each of you all enjoys the most about your careers. Do you want to start us off on this one, Conor? What do you enjoy the most about your job?
Probably when we get weird cases through that are interesting. Things like, cavities and ears that have been operated on and stuff. They're really quite interesting.
Yeah.
And as well, slightly perhaps less kind of technical and gory, but when we fit someone with a hearing aid who's been struggling for ages and suddenly they're just able to hear properly, it's just really, really awesome. to sort of bring someone's hearing back. So that's I'd say that both of those things are on par for me.
I'd agree. I think it's such an emotional. It's such an emotionally charged appointment as well. When you fit somebody with a hearing aid and you see that switch on, and suddenly they can interact with their family, and their family can interact with them, and it's such an emotional thing for both the patient and their family as well. It's really good. Yeah, it's lovely. That's one of the things we really love. I mean, I along with Conor on this one, anything weird and wonderful that we come across, I really enjoy this. It's slightly more out of the ordinary things that we do. I really enjoy those, and the challenging wax. And do you know what I really love is the ones that come to your clinic and they've been to 2 or 3 other places and they couldn't get the wax out or do something with it, and then you can get it out. That's always quite it's a bit of an ego boost. We quite like that one as well.
I know. Yeah.
Really? Oh, that was easy. Ha, there you go. So lots and lots of shout outs now. So we're going to do the last 5 minutes. We'll do quick. So thank you both for a very interesting live chat, Kim. And you're more than welcome, Kim. We thoroughly enjoyed doing it. Let's have a little look. What else have we got? So we'll do this one, Conor.
Sorry.
Oh, hang on. Wait. There you go. Montreal.
Hey, Maggie.
Hi, Maggie. Miriam from Argyle, Scotland, big fans. Thank you very much. Oh, the Weather Witch. Are we due for a change?
Northallerton.
Ah, there you go. From Ohio in the USA here from Terry Wetz. Hello, Terry.
Hey, Terry.
Let's have a little look here. Jenna from Essex. Big fan, been watching for years. Love being around.
I used to live in Essex.
Oh, did you?
Yeah, I used to live in Southend-on-Sea. Hey, Jenna.
Oh, lovely. Go on, Scott. You can read a couple out. Go on.
Yeah. Hey, Steph. Thanks for watching from Nottingham, UK. Crayford, Vicky in Crayford. I don't know where Crayford is.
I'm not sure where Crayford. I've never heard of Crayford before.
Crayford.
Ontario. Hi guys, Tracy. Hi Ariel. I love what people have been trying to help in the. I love that people have been trying to help in the chat too. Oh, fair play. That's really good. Do you know what? That's one thing we would say about the audience. I'm sure yours are the same, Conor, because I think our audience is pretty much the same audience anyway. But they are really knowledgeable now, and they're quite an embracing community as well. I do find with these, they kind of take people under their wing and try and help as much as they can. Jill McCaffrey from the Isle of Man. Hi, Jill. Georgia, now from Germany. Kathleen.
Hi, Kathleen.
People from everywhere. There you go. Another Essex from Peebles. What does Mrs. B look like? I noticed Mrs. B clicked off that one really quickly. Stunning. Mrs. B, stunning. Lorna from Boston. USA.
I concur.
There you go. Muse, yep, love from NYC. Go on, Carl, you can read a couple out.
Hey, Lainey from Vancouver.
Holly S. Should we do alternates, Colin? We'll do alternate. Go on, Holly S.
Yeah, sure.
Hi, Holly.
Lisa from Virginia. Thank you very much, Lisa. Thanks for watching.
Stephen, the waxing lyricist in Coventry. Hi, Stephen. Do you know about the waxing lyricist, Conor? Do you know about this guy?
No.
Stephen's fab. Stephen, when we do our wax event every year, Stephen writes audiology-related lyrics to the 12 Days of Christmas and posts it on our YouTube channel every year. You have to look out for our wax event. It's really, really
in the
good.
comment section.
In the comment section, he's got a bit of a cult following now within the comment section. You have to keep an eye out for it.
Right. I'm fairly sure I have seen something like that, actually. Yeah. I will keep a lookout for that. Yeah. Hi, Debbie.
Caitlin Schmidt, I would love a shout out. Shout out to you, Caitlin.
Hey, Caitlin. Just a PG. PG from Utah. Thank you for watching, PG.
Pat from Houston, even, sorry. Patricia Harrison. Hiya, Patricia.
Hey, Pat. Hasn't Holly S cropped up several times?
I think Holly S, I think Holly S is keen in those comment sections. Hello, Stephen from Virginia, USA. And that's from Joy.
Richie Hall from Missouri. Hey, yeah.
Hi, Wendy from South Shields, Tyne and Weir. Caitlin from Ohio. That was quick. Another one from Caitlin.
Hi, Sheena.
Hi, Kim in Alaska. This was fun. I'm glad you enjoyed it, Kim. Love your videos. Thank you very much, PG. The call from the Netherlands. I got Ariel from New Jersey. Rhiannon P, thank you very much. You are more than welcome, Rhiannon P. Don't forget, guys, if this is something you would like to see me and Conor do, or if you want to see us get together with the always lovely Mr. Taylor Green and Richard Neal, drop it into the comment section. Do us a favor and comment on their videos to say you'd like to see it as well. You never know. It might just encourage them to come along and get it come onto a live with us as well. Well, guys, we're down to our last 10 seconds. So I want to thank Conor massively for coming on and helping out with the live today. It's always lovely to see Conor. He's an amazing audiologist and very knowledgeable guy as well, and lovely as well to boot. So thank you so much for coming along, Conor, on the video today. And fingers crossed, you fancy doing this again, Conor?
Absolutely. It's been fun. It's been a blast. Thank you very much for having me.
You are more than welcome. So, guys, thank you so much for watching. As always, take care of yourself. I've got to do the end bit, sorry. As always, take care of yourselves, take care of your ears, and take care of one another. Conor, you have the last word. Go on then.
I will see you on the